so the hallmark of any addictive substance or behavior is that it releases a lot of dopamine in our brain's reward pathway. Like broccoli just doesn't release a lot of dopamine, just doesn't, right? But what happens right after I do something that is really pleasurable and releases a lot of dopamine is, again, my brain is going to immediately compensate by down-regulating my own dopamine receptors, my own dopamine transmission to compensate for that, okay? And that's that come down or the hangover, or that after effect, that moment of wanting to do it more. Now, if I just wait for that feeling to pass, then my dopamine will re-regulate itself and I'll go back to whatever my chronic baseline is. But if I don't wait, and here's really the key, if I keep indulging again and again and again, ultimately, I have so much on the pain side, right, that I've essentially reset my brain to what we call like an anhedonic or lacking in joy type of state, which is a dopamine deficit state. So that's really the way in which pain can become the main driver, is because I've indulged so much in these high reward behaviors or substances that my brain has had to compensate by way down regulating my own dopamine, such that even when I'm not doing that drug, I'm in a dopamine deficit state, which is akin to a clinical depression. I have anxiety, irritability, insomnia, dysphoria, and a lot of mental preoccupation with using again or getting the drug. And so that's the piece there. There's the single use, which easily passes, but it's the chronic use that can then reset really our dopamine thresholds. And then nothing is enjoyable.